agentic AI has opened up this box even more. Our healthcare system on the whole is completely oriented, and the system's designed around economic. How much can we minimize the risk across populations? That's again why we need ethical AI and well-governed AI right now, because AI in the future might think it can do things like that. It might think that it's able to make these kinds of human decisions on behalf of humans.
Welcome to the Digital Legacy Podcast, where we talk about death and dying in the digital age. If you ever asked, how do I protect myself and those I love if something unexpected happened to me? You're in the right place. I'm your host, Niki Weiss, and together we'll explore how to protect yourself in a world where both your physical and digital legacy leave a lasting impact. And welcome back to another episode of the Digital Legacy Podcast, where we talk about death and dying in the digital age. I'm Niki Weiss, a digital thanatologist and your host. I'm super excited today to invite Brian Green. Brian is here in the Philadelphia area. Brian, we started talking because it was about AI in healthcare, AI governance, AI responsibility. And so when I was sharing with you about my death and dying in the digital age, you realize like there's an intersection here, ethical AI. So please welcome to the show.
Thank you. I'm glad to be here, and I'm glad to be part of your community, talk to your guests and your podcast listeners. I think this is an important conversation. We are living in a digital age where we have more access to information than ever before. It's hard to filter through the noise and hard to filter through the actual information that people need at the specific point in time where they're really looking for support as well as just information and knowledge. AI and social media have fundamentally changed how people learn about death, dying, and care options, and then fundamentally, as well, how they then access resources that they're looking for to get help and get information and get support. And that's really a challenge. And it's also one that opens up the Pandora's box, so to speak, of ethical challenges, particularly in the AI world, where AI is being pushed out very quickly. Agentic AI has opened up this box even more. So we have security issues, we have some privacy issues, and we have the challenge of AI not matching our human ethical framework because it hasn't been built with that in mind. Now we could literally construct better grounded foundational models that are grounded in human ethics and grounded in robust governance frameworks, but we're not there yet. And this is an area of healthcare and surrounding care where it's kind of critical.
Well, I was just going to jump in and say it's interesting how people nowadays are heading to their doctor's offices or their surgical consults with already a load of information where they used to lean on the healthcare provider to educate them. And now they're educating themselves. And with the multitude of information available with the different generative AI platforms, how much of it is relevant? And I would think as a healthcare professional, I'd feel a little frustrated that my patients are coming in questioning my expertise.
Yes. That's a challenge now for people with chronic health conditions, so talking to patients that are living with chronic health conditions, chronic pain, things where they're already frustrated with the healthcare system. Sometimes they feel gaslighted by traditional healthcare. And so they're already skeptical. And so they're turning to these sources of information, which makes sense. It's logical. But then providers sometimes either get frustrated with it or just are not sure themselves how to handle that. So one thing I do on the provider side is talk about how providers can actually use AI themselves, again, ethically and a governance framework, but they can use it to enhance how they engage with patients. So doing it in a patient-centric manner and doing it in a way that meets the needs of the patient where they're at to facilitate better communication. Sometimes the patient or caregiver is not looking for an actual answer to their healthcare question. They're interested in someone that simply listens to them, shows empathy, and then is supportive of listening to the things they're worried about or concerned about.
Oh, it's
And we see that with AI and how people are turning to AI as a companion in times of crisis and in times of healthcare crisis.
and we know that that could be very dangerous in many, many ways. I just want to take a pause here because I'm curious about your background. What got you so deeply involved in this ethical issue that is now facing us within the artificial intelligence space and healthcare?
That's a good question. I have a background in healthcare, which started many decades ago. I would say 30. I hate to throw my age out there, but 30 years ago. I started as a social science researcher, so like a data science in public health, in the nonprofit world. And my first research project I worked on was HIV prevention. It was a longitudinal study. I won't go into the details, but it was a prevention project that was behaviorally oriented. After that, I also did on the care side. So I worked with HIV positive people, including women and children that were born, originally before we had the protocols 076 trial that prevented perinatal transmission. We had babies being born that would seroconvert with HIV. And so the healthcare sector and the social service sector was completely overwhelmed with the early decade of the pandemic, right? And so when I jumped in is when, the Ryan White Care Act was just starting to emerge, systems of care, um, centers of excellence were being developed. In that work, I always started with the patient needs, their family, right? So family-centered care is something that we specifically developed a model for within the context of HIV care. And in that process, working with people that were often not welcomed within traditional healthcare settings originally, you have to lead with empathy. You have to lead with listening and understanding that even though you're concerned that they're living with a disease that, early on was considered a death sentence, they've got tons of other problems they're dealing with: housing, affordability of just their daily life, relationships, family members that don't want to speak with them anymore because they are HIV positive, or struggling with disclosure and could I tell my employer, all these kinds
And
of
this is
issues.
back in the
So
80s and
have
90s.
this was back in the late 80s. The Ryan White Care Act, of course, passed Congress in the early part of the 90s, and then mid 90s is when we had the Ryan White Care Act kind of roll out kind of nationally and provide, a supportive safety net for people. So during this period of time is when this work was critical, and that's where I learned the value and the absolute necessity of patient-centered care and putting the patients first. So even though as a data scientist and a data person and a researcher, that was a very critical lesson learned. And that's how I've carried those lessons forward with me, throughout my career in other contexts. So when I left the nonprofit sector, I jumped into the private sector, and worked with a company that was more aligned with, say, pharma marketing and pharma market research. That's how I got interested in AI because we had a lot of first party data, second party, third party data. We had to automate all of our back end data flows to better serve and meet where the patients were in terms of the information, the content we're producing, these sorts of things. And so, again, similar lessons learned, but working with online communities, communities that were 100% online, looking for information in the digital age as opposed to in-person physical communities. So that's a long answer to kind of how I got to this space. But once I started working in the AI world, noting that it's so focused by technologists and software developers, people in that world, in healthcare in particular, they're not always, it's not that they're not empathetic people or people that come to work in a different way. It's more that they just aren't aware of it and they haven't worked directly in healthcare. So understanding these sensitivities is really important and something I've just always focused on and brought to the table when I started working in AI.
Well, I mean, empathy is what's been driving the adoption of at least some of these chatbots. I
Oh
mean,
yeah,
people are
yeah,
ditching their
absolutely.
therapists.
I think once ChatGPT, hit the marketplace, entered into the world, what we call conversational agents, right? So generative AI used for conversational purposes, like a chatbot or more extensive, browser-based um, answers for like ChatGPT or some other similar engine. People, like everyday users, um, very quickly understood and could see evidence that, wow, this thing is really understanding me. It's empathetic. It's responding in a way that I would prefer to get from a human, and I'm not used to getting that kind of support or that kind of empathy. The challenge is AI is only mirroring human empathy.
And I'm going to have you pause there because some people might not understand that concept of mirroring within the AI
Yeah.
functionality. So if you could bring it down to layman's terms, what does mirroring mean? And when I'm interacting with with an artificial intelligence, how is it mirroring back to me?
So AI can only simulate compassion, right? It can't witness real suffering, right? LLMs, the models that generative AI, ChatGPT, conversational agents are based on are literally, mathematical predictions around next word tokens in strings of information. So its algorithm is able to pick out human text as an answer because it's had this corpus of millions, trillions of pieces of information and says, guess what? When humans write a poem or write about an article or post information on the internet and they're trying to be empathetic, they tend to say these types of words, right? Those words, though, are not contextual. They're just a response that appears to be an empathetic response to any kind of generic situation. Now, LLM's gotten a little bit better of contextualizing some of this. So it knows a healthcare situation might be a little bit different than your rejected mortgage application, right? So it's able to do a little bit of fine tuning and understanding some context, but it's still very limited. So LLMs can feel like they're warm, feel like they're validating, feel like they're non-judgmental, but they're not moral agents. They're not spiritual guides, right? They're not clinicians. They're only mimicking patterns that they've seen in the human, either the corpus of what they've been trained on, or me as a user, if I've been constantly asking and interacting with ChatGPT for, say, weeks, it learns my patterns, right? And so it's mimicking and presenting back to me in the same manner that I've tended to ask the questions. If I sound with some guardrails in place.
Well, let me jump in because here's my
Yeah.
challenge is that in the healthcare space, right? Just in the last couple of years, or if you have a crystal ball, a magic 8 ball, like what is the prediction? Because I'm starting to hear rumblings of they're bringing AI decision makers into ICU space to
Yes.
make aggregated decisions for a
Yes.
patient. How are bedside physicians and clinicians using artificial intelligence either on their tablets or their phones in order to make a determination on medication or particular discharge? What do we see today, and what should we be expecting in the next 12 to 18 months?
Yeah, that's a great question. I mean, I think there's lots of use cases for AI in healthcare settings and situations that are evolving and evolving very rapidly, right? We're starting with the
Hmm.
kind of foundational thing that almost every larger scale health care system in the US is doing right now, which is called ambient listening. And it's literally like a device that listens, to, could be their phone, that is a physician activates during the patient encounter, like meeting with my doctor. They should be consenting you first. They're like, it's okay if I record, um, and it's designed to then summarize and synthesize that session, dump information into the EHR or the charting tool of the entity, the healthcare institution, so that the physician is able to follow up more efficiently and not have to spend an hour at night typing in, what they have in their notes from a patient report. Now, what so recent research has shown that it doesn't save that much time for doctors themselves. It's taming some time for the institution, the hospital in this example, um, and therefore saving, overall cost. And so it's a cost containment measure that is maybe helpful. This is a use case that I'm not the most thrilled with because I don't see it necessarily as patient-centered, right? Unless I've seen data that it actually improves patient care or helps with patient communication or helps the physician in the moment listen better to a patient and respond empathetically, in a more human way, then it's not necessarily a better tool than what they're currently doing. Yes, it's better than them sitting there typing while you're supposed to be talking to them if you're the patient, but it's not necessarily a improvement from the patient perspective. And I have not seen the data to prove that that's a wrong, kind of statement. So I'm concerned about where a lot of people are starting. It's in low barrier, and that's why they started there. In terms of using it as a diagnostic tool, essentially, or in a triage setting, so an ER setting, for instance, to kind of help facilitate a decision. We're at a place right now that we should never be using AI in healthcare in a way that is not well governed and in a way that does not have some kind of human in the loop guardrails and checkpoints and escalation points. So, for instance, in a diagnostic, AI can make specific recommendations, but the physician should always be the one making the determination of which of those recommendations makes the most sense for this clinical case, for this particular patient, for the context, for where we're at right now in their care. Also, though, they need to be able to explain that to the patient and explain it to the other parts of the care team, right? There may be a referral that's needed for a specialist. There also may be a layer of documentation that's needed for the payor or the insurance company, right? So the explainability of the AI models needs to be there. And that's also missing. We don't have good explainability of how AI has always reached decisions, unless we start with what I call a governance first framework and have built it that way from the beginning. So that's kind of the situation we're in right now, is a lot of companies have pushed forward trying to sell into healthcare for this, their best solution, and they may have great ideas, but if they don't start with a governance first framework and an ethical framework, it's much harder to fix problems later than it is to build it up front correctly. It's going to cost a little bit more money. It's going to save money in the long run because you're not going to have the same kind of problems with, leakage of privacy, protected data, potential lawsuits, errors that are made, those sorts of things.
I mean, isn't that the problem that we're facing right now is that the technology is developing faster than we can that we can put guardrails or that the government can create some sort of
Yep.
governance laws. It's like a runaway train at this point. The way I describe artificial what we've been created is as though that AI is like a luxury 747, like a luxury airplane, whatever the latest luxury airplane is, and everyone is flying around the world on this luxury airplane, sipping champagne, enjoying it. But what everyone's not talking about is that this plane does not have landing gear.
Or, or because modern aircraft that we're familiar with have AI embedded in them already in lots of different ways. So, for instance, we've had automatic pilot for how long? Where automatic pilot is
Right.
the kind of computerized applications and algorithms to set a lot of the safety and landing, takeoff, all of the things that planes do. Pilots take off, switch it to automatic pilot after a certain amount of time. However, an automatic pilot is a great thing, but what would happen if automatic pilot just malfunctioned and accidentally turned itself off mid-flight? Then it's harder to land. And most pilots are going to be able to land a plane, because they've been trained, they've done this for years. But what if the weather conditions change dramatically? What if they've had to lose altitude because of a storm or because of other planes, whatever? We've seen this happen now where planes have lost automatic pilot. It's, malfunctioned, and it's very difficult to land planes in these types of settings and scenarios because there's literally a sequence that you have to, and so they have to pull out the book, the manual book, and go through what the sequence is because if you haven't done it in 10 years at this specific airport, it might be a little bit different, whatever. And I'm not a pilot. I've only read about these kinds of challenges. But
But to translate it back into
yeah,
healthcare terminology, the one, let me give you this scenario from a end of life standpoint. You have a solo ager who doesn't have any significant family that's bedside, and they are in a very expensive healthcare situation, tens of thousands, thousands of dollars a day, and their money has run out, and the facility needs to make an ethical decision.
yeah.
Who makes that decision? I mean, can there be a program, some sort of default where are we going to get to the point where we're not going to be making those decisions on quality versus quantity of life? It's going to be more of an economic decision, whether they keep us on life support or they pull the plug, or in some states and countries that there is the medical aid in
Right.
dying option. Is it going to be do you see the future where artificial intelligence is going to actually facilitate, if not drive, that decision making, that data driven decision?
$1 million or even, billion, $1 trillion question we're kind of faced right now. AI, because AI use cases have progressed much quicker than regulatory and ethical frameworks have been able to catch up. Now, I'm of the mind that, I don't believe that, like, to governance to me, AI governance, robust AI governance to me does not mean I sit around and wait for the government to issue regulations and tell us what we need to do and how do we comply and what are the consequences if we don't. No, governance means voluntary kinds of things that people put in place because they know they need them. They're good business decisions and they're tied to ethical frameworks that are the norm, frankly, in healthcare. Look at clinical trial research that's done in every major teaching hospital in the country. They have an institutional review board, an IRB, that's a group that is charged with making sure that clinical trials are always conducted with ethical frameworks in place, right? Frameworks in place, right? That same kind of, the analog of that is having an AI governance and ethics committee at those institutions as well. We have not seen that happen. There's some cases where they do exist, but it's not a norm across the board. I think it needs to happen.
And
I think
I mean, it's
any
December 2025. Don't you think that a year
yeah,
from now that's going to be pretty prevalent?
I think every major hospital in the country will have one. Yes. Now, whether they're set up correctly or whatever, I'm not sure. Smaller, so, but think of like smaller community-based health centers,
Right.
right? Clinics that really can barely afford what they're currently
Right. An
doing,
MRI
right? This is
machine.
a
Right.
stretch for them to do. Yeah. And I mean, but the thing is, a good committee, just like an IRB, people that are on that committee are volunteering their time. It's not their full-time job. They have another job. They're a clinician, they're the data
Right.
person, they're the nurse, but you're setting aside a certain number of months for this dedicated activity that is essential to the overall organization. Same thing here, right? This is the structure. Now they have made to bring in an outside consultant like myself that can help them set it up. But I've also been on the flip side. I've been a community member of an IRB, of a community review board, part of the IRB that reviewed and made recommendations to how to conduct a trial better, how to ensure that it was part of the community, embedded correctly, and that we were handling it responsibly, recruiting patients, potential patients into a clinical trial and handling it the right way. And I was, volunteering my time, of course, to do that. But I've been part of that process on the research side, right? So I know why it's important. I know that it's valued, that the role is already valued in healthcare organizations. And so this is a very strong analog to that. It's harder. It's a little bit harder. Well, say a little bit, it's a lot harder because AI and particularly agentic AI is a lot more complicated. And people start, unfortunately, with AI just by bringing in the tech people. They think that they have all
Yeah.
the answers.
I mean, what I'm thinking about is, I mean, artif the wearables. Like,
Hmm.
I would say if you're
Yeah.
wearable, if you're a new founder and developing new technology and you don't have AI in your wearables, I would believe it'd be hard to get funding today.
Oh, yeah.
I mean,
Yeah.
so it's
I mean,
become kind of like if you don't have AI in your application, in your solution, don't even bother coming to us.
well, I mean, the thing is, any device like medical, like wearable device, all this, it's basically data, right? Um, and the quality of the data and how you utilize your data and how quickly you can ingest that data and utilize it, that's where AI comes in,
Right.
right? Because we've always had the ability to utilize this data, analyze it statistically, develop, use cases and programs or services, enhance medical care around that. But there's this big gap in time between being able to utilize that data, learn from it, make these incremental changes. AI makes this happen. I won't say instantaneously because you need the human in the loop review checks. You need the governance
Today,
committee. There's pieces
today,
today, but even with automation, and I
right.
could automate a lot of this, I'd still automate it with very clear human checkpoints. But it's still going to happen much, much faster. And the fact is that the device that I'm wearing provides continuous data, right? And again, we're not set up, organizations that handle data all the time, healthcare institutions are not set up. The FDA is not set up for continuous data. It's points in time, what we call event driven. That's how traditional statistics and analysis is done for clinical trials. Um, there are some ways of doing continuous data cost a lot more, right? And the FDA is coming through, I mean, like medical devices, are treated as a medical device that has to go through FDA for approval or not, right? There's gray areas around how AI is utilized right now. That's being worked through. Outside of that, we still have the issue of continuous data collection and the fact that what do those data mean? So you need what are called, clinical endpoints, meaningful clinical endpoints or proxy endpoints. And where the research has not caught up is we don't always have great proxy endpoints for certain healthcare conditions or for treatment effects. And that's where AI can help, right? Because FDA is not going to approve a device if you cannot validate that this proxy endpoint helps improve care or is better than some other measure. And so there's some organizations, some companies that are doing that work, which is greatly needed. And when we have better proxy endpoints, clinically significant endpoints that are measurable based on continuous data, then we'll be able to really transform clinical trial design and device approval pathways at the government FDA level, for instance, much quicker. Um, where's I don't know how, like, that's hard to predict because that's not my core area. I don't do medical devices. I never have, but I know the data side, right, and the challenges from a statistical and data perspective. My guess is we're at least 2 years away to seeing meaningful movement in continuous data collection outside of some very specific cases. There's been some that are cardiovascular. There's a couple validation studies that have shown the validity of continuous data monitoring for some cardiovascular conditions, but not all cardiovascular conditions, only very specific ones, right? And
Right.
there's some other things like this as well. Diabetes monitoring, of course, is one. But again, um, what is the implication of that? That means that one device, one type of device might be approved, not everything that then cascades down.
I mean, this whole topic just fascinates me. Even to take the technology and where we are today, it's hard to imagine where we're going to be again in a very short period of time. We're talking months, not
Yeah,
decades, or and
exactly.
how that's going
Yeah,
to intersect and start making these medical decisions for us,
yeah,
or at least influence our clinicians to make recommendations, and
yeah.
those decisions might be economic driven, right? I mean, I could see that being baked into the decision making process.
Well, of course, unfortunately, I mean, our healthcare system on the whole, because of, who pays for it, the payer side is completely oriented and the system's designed around economics, right? Who's
Right.
paying for it? How
We just
much
can't
can
deny
we
that.
minimize the risk and the cost across populations that are at higher risk? These are all, traditional ways of kind of deriving an actuarial table that derives insurance, right? Well, just death and dying. I mean, it's a little removed from traditional ways of thinking about healthcare from an economic perspective, only because you know end of life and death is the endpoint event from a lot of healthcare research. You know, Unfortunately, that's the ending point of research and showing that something's a profitable model or not, right? And so, like, what do we have after that? Unfortunately, we don't have a great body of research that talks about how to best support people, individuals,
Uh,
patients, caregivers, families around this impact, what it means for how you prepare yourself, and then once this happens, right? And so we're missing, even if the perspective is like, let's look at research, let's look at it, we're just missing so much, right? And that's the challenge of thinking that AI could potentially solve this for a problem like this for us. It can't, because it doesn't have anything to go to and pull information from, right? It's not designed that way. That's again why we need ethical AI and well-governed AI right now, because AI in the future might think it can do things like that. It might think that it's able to make these kinds of human decisions on behalf of humans. We don't want AI or any computer or any algorithm to ever make decisions for humans that are ethically based.
I'm biting my tongue because we're coming up on time here, but there's one topic that's now burning in my head, and we might need to do a part two, which is transplants. When
Oh, yeah.
I feel like I just need to just put that on the table more as a reminder to
Yep.
myself, is like,
Yep.
what if AI is going to make that decision with a transplant patient, whether they continue on life support or they take them off life support in order to harvest organs to save somebody else's life? Maybe that
Yeah.
comes out of the hands of the family's decision and into the hands of something like artificial intelligence. Well, listen, I don't want to go down that rabbit hole right now. But for our listeners, Brian, this is like fascinating how AI is oh my gosh, is going to be like intersecting, and people should be getting comfortable that you're going to go into your clinician's office and they are going to be letting you know, hey, by the way, you're recorded. And I think at some point people are going to get immune to that. They are not just there. It's not just the two of them, that their conversations are being recorded and analyzed, um,
Yeah.
and aggregated as well. So, any words of wisdom or takeaways that our listeners can be thinking about as we close out here?
Well, yes. I mean, I talk about ethics, and that means different things to different people. But essentially, there are responsible AI principles that we need to have in place, and they look a specific way in this context. So we need transparency. We need, sensitivity around the context itself, in this case, death and dying. We need cultural humility, right? That's challenging right now because, in this culture, we have very different views around death than other cultures, right? And so AI is able to access a lot of that, not just one society's culture. And so that's a challenge as well. We need clear boundary setting, the ethical and AI governance part. AI should not play the role of a clinician or a spiritual advisor or even, someone, a trained um, counselor for suicide crisis prevention, right? Um, they should not ever play that role. And therefore, people, everyday people, need what I call digital literacy and AI literacy. They need to understand that AI can sound and mirror sympathy and empathy, but it's not sentient. It's not, wise. Um, and, I think importantly, talking about death and dying, death forces us to confront what it means to be human, right? And in the digital age, it's also forcing us to confront what it means for technology to become, a companion or an empathetic witness
Mhm.
or something that may provide some level of support in this process. And that's going to happen, right? It's happening now. The challenge is ensuring that AI serves our humanity, our human ethics, our human goals, and doesn't ever replace it. So we are in a very important moment in time
And
that is critical for us as humans to step up and
engage.
prioritize ethics.
Yeah, and engage. Well, with that, thank you so much, Brian. And if people wanted to reach out to you, where can they find you?
Well, I'm on the internet in many different places. My main website is health-vision.ai. I also have my development company, which is envision-health.ai. I have several blogs as well, and they can also email me. My email is brian@health-vision.ai. That's my direct email, my business email, but I, check it all the time. So email me, feel free. And yeah, happy to continue the conversation with your listeners or with people, directly one-on-one, and with you again, Nikki, as well.
Perfect. Thank you so much. And we'll end here. Appreciate your time.
Okay.
Thank you for listening to the Digital Legacy Podcast, where we talk about death and dying in the digital age. I hope this conversation inspired you to take control and plan for the inevitable to protect yourself and those you leave behind. Don't forget to subscribe to our newsletter at digitallegacypodcast.com. Remember, life is full of surprises. What happens after you die shouldn't be. So keep your passwords safe and your playbook up to date.